Welcome to Rejuvalife's Vitality Institute of Beverly Hills. Dr. Andre Berger will be here today to discuss the Age Management Program. Thank you, Dr. Berger, for being with us here today and taking the time to discuss age management. Can you go into detail about what your age management program is?
Well, age management is about how we can keep people with a maximal health span as they live throughout their lifespan. In other words, as people age, things begin to deteriorate. People lose their vitality, they lose their energy, they're not sleeping as well, they use their libido, their sexual function isn't as strong as it used to be, they use their muscle mass, they gain weight, they get tired, they become more and more susceptible to chronic disease. And so what we try and do is work with our patients to reverse many of these things and also to prevent them from progressing or from happening. This is done by a very comprehensive approach. What we try and do is attain optimal balance. And what we are talking about here is the balance between having a optimal lifestyle, which is the foundation, and then balancing things above that, which primarily include the hormones. And we try and bring our patients to an optimal level of youthful range of hormones.
Now, when a patient comes to you and becomes a part of the age management program, what can they experience over time?
Well, they're going to experience the most important thing, and that is they're going to start feeling better. They're going to start feeling more energy, more vital. They're going to start having more muscle mass. They're going to be able to just do more competitive in the workforce, thinking clearer. They're going to have a better sex drive. They're going to just feel all the things that they used to feel when they were younger. And that's what we're trying to achieve, bringing back some of the positive things about youthful health.
So obviously it's the things that you show them and teach them and provide them with helps them balance out their life when they're away from the office, basically is what you're saying.
Well, what we're saying is that as we age, many things happen to us that in many instances can be prevented. Everyone wants to look good and feel good. And so by getting into a more comprehensive program of balancing lifestyle and hormone levels, we then have an opportunity to achieve that. We have an opportunity to feel better and to look better, to become more competitive and more adaptive to the environment in which we live and which we work.
Now, Dr. Berger, is there a particular time frame that a person remains on the program, or is that on an individual basis?
Well, the initial phase for our patients is about 7 months. It takes about that amount of time for the patients to get optimized. And what I mean by optimized is that we get them to a youthful level of hormone balance. That is to say, we get them to a target of the median range of hormones for a man and a woman between the ages of 20 and 30. And once we get there, we also want to make sure that while they're optimized, they're also feeling better. So we're going to monitor how they're feeling better, improving in various ways, reversing some of the complaints they had while we're optimizing them. Once they're optimized, and this would occur again, as I say, in the first 12 to 16 weeks, then we want to keep them there indefinitely. So we'll continue to see them and monitor them in this way. But after they're optimized, as I remind all of these patients, it's their program. And so they will decide on their own how they wish to continue, and some of them will cycle on and cycle off, and some will just keep on going. This is a lifelong program. This is not a program for a discrete period of time. It's something that people usually will wish to and need to do for the rest of their lives, but it's certainly something that's flexible, and people can decide how long they want to stay on the program.
Now, Dr. Berger, can you briefly explain what bioidentical hormone replacement therapy is?
Bioidentical hormones are hormones that are identical chemically to the human hormone. So when we use bioidentical hormones, we're using hormones that are indistinguishable from the human hormone. That is to say, we're using something that is as natural as it could possibly be without actually being your own hormone. That is what we use to the extent possible where it's available when we're modulating or replacing deficient hormones in our patients.
Once again, thank you, Dr. Berger, for being with us and sharing us all your knowledge that you have on the age management program. We definitely look forward to coming back and spending more time with you.
Thank you, CC. I look forward to that.
Please be sure to join us again as we discover new and exciting topics to discuss with Dr. Andre Berger and the Rejuvalife Vitality Institute. I'm Cece Perkinson reporting for CC Variety TV.